million children are living with food allergies in the U.S., with reactions ranging from skin issues to potentially fatal consequences. That is why it's so important for parents to be well informed. Here to explain more about kids and food allergies, we welcome back the author of My One-of-a-Kind Body, Pediatrician Dr. Whitney Casares. It's so nice to see you. Thanks for being here.
Thank you for having me.
Lots of questions for kids with food allergies and whether or not they're sensitive to certain things. What are some common allergies that parents and kids might encounter?
Yeah, so the most common allergies have stayed consistent throughout the years. It's things like peanuts, shellfish, egg, dairy. Those tend to be the big ones. There are other allergens as well. And actually, really interestingly, we saw a huge uptick in allergies when our recommendations as pediatricians used to be to not feed kids allergenic foods until about a year of age. Proves why science is always evolving and, you know, we're always learning. Now we're telling people to introduce foods as early and often as possible, and also for pregnant people to be consuming allergenic foods, and it's making a huge difference. So that's super important.
Yeah, my kiddos were babies when we first started talking about introducing peanuts and peanut butter earlier. And it was a huge revelation, right? Wait a minute, I thought we weren't supposed to do that. So you gotta stay up to date and know what the latest and greatest stuff is.
Yeah, and I think it makes a ton of sense, actually, right? Like, restricting it made sense because we saw, oh, we're having these kids with food allergies, so maybe we shouldn't expose them at all. But from an evolutionary standpoint, a biologic standpoint, it makes sense that you would not make it so that this is a foreign substance to a kid once they see it. It also, from my perspective as someone who's a body confidence expert, really goes along with that idea of feeding the rainbow, of having diversity, of not making certain foods off limits. And it's interesting to me, I traveled in Italy and in France a couple years ago with my kids and with a kid who happened to have a food allergy. And in Italy, they're very, very conscientious about this. They're like, show us your little card that says what you don't have, blah, blah, blah. In France, they're like, why would you come to this country? You know, they basically feed their kids all the foods. Their kids have a great relationship with food and with their bodies, and also they don't have as many allergens as we do.
Okay, what are some symptoms we should watch for to find out if a kid might actually have an allergy?
Yeah, so the symptoms can vary, like you said, and it's important to know that if a food is introduced to a child, they might not have the allergic reaction right away. So it can be after multiple exposures that they have the reaction. The most common things for a major allergic reaction would be things like hives, which are big welts or bumps that come up on a body. Also having things like vomiting or having swelling on your face. And then the biggest thing is the respiratory issues, so a lot of difficulty breathing. There are also some kids who don't have a traditional food allergy, but they have what's called FPIES, and it's more of a gastrointestinal response to the food. Still falls kind of within the allergic world, but it's more like you just have the vomiting stuff, you have more diarrhea, stomach upset, and then skin issues can be separate from that.
Is that kind of what we would call more of like the intolerance side of things?
Yeah, sometimes, but sometimes it can be a true issue that the child is having with the food. So not just like it doesn't sit as well, but more like, no, every single time my stomach does this thing. But what I'm more concerned about as a pediatrician is, of course, the more severe allergic reactions.
Let's talk about diagnosis and testing. What should parents know about that?
Yeah, so you can do testing really, really early for kids, but it's not as accurate until a child reaches about 2 years of age. That said, for kids who have straight up hives, difficulty breathing, all those things, we want you to tell your pediatrician right away. Please don't wait until they're 2 years old, right? And we're happy to walk you through. Oftentimes it means doing some testing, blood testing at the pediatrician's office. Sometimes it can mean going to an allergist and having skin prick testing, which is where they actually put a tiny little bit of what would be considered the allergen in your baby's skin, and then see if there's a reaction that happens in a controlled environment where, of course, it'd be very safe for your baby.
Not super fun, but probably worth it in the long run to make sure you have all the information.
Yeah, and actually one of my kids had that testing. It was not as big a deal as it felt like it would be.
Awesome.
It's like an acupuncture needle. Very, very small.
What about thinking about just living with food allergies, especially during the holidays, ways that we can keep kiddos safe this time of year when there's lots of hustle and bustle and maybe different loving adults in their world?
Yeah, totally. So first and foremost, if you are the parent of a child with a food allergy, do not feel ashamed or embarrassed to, with your family, say, this is not just an intolerance. This is not just a preference. This is something that can be life-threatening for my child. Please let me know all the different foods that will be there, what's in them. The other thing is, I think, I have a child who has special needs in different ways, that it is my own responsibility also to make sure that I provide for my child what they need in a family setting. So, make sure that you bring some safe foods for your child to have in case there is not anything that they can eat. Make sure that you are carrying that EpiPen if your child needs it, so that if they do have a severe allergic reaction. For allergies, oftentimes this is a lifelong thing, and so we do have to teach our kids from a very early age about what these foods are that they can have, what foods they need to stay away from. So that's one way to make it a lot more enjoyable for yourself and for the people that you're with at the holidays.
Well, and going back to what you said, don't be afraid to communicate in the first place, because sometimes if somebody just doesn't know, then they can't be on your team. Like, I had a kid come to a birthday party and I didn't know that they had a different food need. I didn't have it for them and I felt so bad, but their parent didn't tell me and I didn't quite know what to do in that moment.
Yeah, exactly. You would have been happy to accommodate if you had just known the information, or you could have communicated to the parent, well, what's the best thing to do? Is it for them to have something separate? Is it for us to wait to have the food until they're not there? Like, what would make them feel the most included? There is a really good website also called FAIR that gives a lot of information to families about food allergies when it comes to schools, when it comes to doctor's offices, and then also when it comes to social interactions with family members.
What about labeling food and making sure you're kind of organized and setting your best foot forward that way?
Yeah, so I would say if you're going to someone else's holiday party, they might not have the wherewithal to be labeling things. I would say communicate to that person if it's someone that you know well and it's going to be a relatively small gathering, worth it, to ask them to label some things. I think it's honestly better to have it be that those foods that your child can eat are a little bit separate, so that way the rest of the party can enjoy, doesn't have to have all the labels, but your kids can still have the foods. Of course, if that person is willing and able and it doesn't add a whole bunch of stress for them to label things, that's awesome. And it will be less of a big deal as your child gets older and they can ask specifically, does this have something in it? The other thing to remember is oftentimes, if you're like me, if I throw a party, I don't even know what's in most things because I buy it.
Right.
Or I get it from catering or whatever. And so that's why I think it has to be a team approach.
Absolutely.
You're knowing what your child's allergic to, you're bringing some foods, and the guest is trying to accommodate as much as possible.
Yeah, we're going to get it all done in the holiday season too.
That's right.
Thank you so much for stopping by.
Yeah, it's my pleasure.
So great to see you. Okay, Dr. Whitney's book again is My One of a Kind Body. We'll have more information on our website at katu.com. We'll be right back with more Afternoon Live right after this.